studies have shown that risk of dying from cardiovascular disease is dramatically lower in people that are given omega-3s compared to a placebo. The omega-3 index test is how you should measure your omega-3 levels. They're measured in our red blood cells rather than what you'll 99% of the time find if you get an omega-3 test, it's plasma levels. So red blood cells take about 120 days to turn over, so it's a long-term marker of your omega-3. Whereas if you go and get an omega-3 plasma test, it's kind of like, well, what did I eat for dinner in the last week? You may have had a bunch of salmon, but maybe you don't usually eat salmon. People that have a low omega-3 index, so that would be 4% or less, and then comparing it to people that had a high omega-3 index, so that would be 8% or higher. So people that had the high omega-3 index had a 5-year increased life expectancy compared to people with the low. There's been studies done where people with a low omega-3 index, so the standard American, basically 4%, if you give them about 2 grams a day of omega-3, they can raise their omega-3 index from 4% to 8%. Generally speaking, triglyceride form is the most bioavailable. Triglyceride form is the form that if you're eating fish. Most people that are getting prescription form of omega-3 to help prevent cardiovascular disease, they're taking ethyl ester form. The thing to know is you have to take it with a meal, and preferably with a higher fat meal, because you will absorb so little if you're taking it on an empty stomach. It's very important.